are Hulme Hall Medical Group. We're based across 2 sites in the South Manchester area and we look after 12,000 patients.
If you get to GP at 11:30, it is a sit and wait, but
it is a busy practice. Always got somebody at the desk, always got a room full of patients.
Online services is important to us at the practice and we have 50% of our patients who are now signed up to this service.
We've been offering records access for over a year now. Patients have accepted it very positively. They're very keen on the options to book appointments, order prescriptions and view their records online.
Morning. The online access is helping greatly. It's really enhancing the customer service really. Hi. People come in daily asking for access to the medical records. We hand them the information on a leaflet, explain how it all works. Take this away with you, peruse it, read all the questions, and then we'll need you just to fill in the back, please.
We have a robust system of checking patients' ID when they want to sign up for record access. This just allows us to know who the patient is, are they getting the correct record.
Is it quite easy? It is very easy, yes.
Once they've looked at the form and read the form, they need to come back with some photo ID, which then the receptionist will sign to say they've seen the ID.
So a passport or a driving licence with a picture, and then something like a utility bill that proves that they live where they say. Thank you.
Bye.
Bye. Oh, lovely, thank you.
At the practice, when a patient puts a request in, they will immediately get their PIN number to register online and they will automatically be able to do appointments and medication requests.
Mrs. Mellish, please. So when we're checking records before granting access, we do a check to make sure the record is accurate and there's no incorrect codes or codes that shouldn't be showing. We would be conscious of our role as data controllers not to do any harm by releasing information. So an example would be a patient who has an anxiety problem where you could potentially make their anxiety go worse by releasing certain information. So that group of patients we would arrange to have a discussion with them about whether online access is suitable for them. We're also very conscious of safeguarding issues. If there's some concerns about safeguarding, those records are complex, often contain third-party information, and we would be reluctant to offer records access in that situation. And certainly, if that was an issue, we'd want to have a discussion about it.
Most people who request access for their medical records at the surgery do get it. At the end of the day, it will come down to a clinical decision.
We've allowed records access for almost 200 patients. It's actually really unusual to have to deny someone access. Screening the records, we've identified out of maybe 200 patients, a couple where we'd want to have a conversation with them about whether records access is appropriate. And there was just one case which was a safeguarding issue where we decided that records access wasn't appropriate.